You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. On this episode of the Dr. Tyna Show, I'm sitting down with my good friend, Nicole Jardim. Nicole is a women's health coach and a menstrual cycle expert. I have learned so much from her over the years. I met Nicole years ago, way back when I just was getting started online, and we've been friends ever since. She's a goldmine of information. She has a fabulous platform, an incredible membership for the public, an incredible training program for health professionals and health coaches alike. And I was so happy that she finally came on today. If you are a woman, you need to listen to this episode, whether you're a super young woman or a woman in her 20s and 30s of childbearing age, or a woman heading into perimenopause, or even potentially a postmenopausal woman. I think you're going to find answers in here that you maybe didn't know before. Your menstrual cycle and the health of it and vitality of it impacts the rest of your health throughout the rest of your life. So without further ado, let's jump in. Nicole Jardim, thank you so much for coming on the Dr. Tyna Show today. You are a dear friend of mine, and we have been through a lot the last few years, and I'm so glad we finally got you on today.
I know. Thank you so much for having me, Tina. I am so thrilled to be here with you. I can't wait to get into this stuff. It's going to be so good.
Yes. Well, I met you years ago, and you were a period expert, like menstrual cycle period expert, women's health coach. And I didn't really understand what you did, to be honest. And I started following your work really intensely, I don't know, years ago. I mean, you're OG. You've been around a long time. And I realized, like, damn, this woman knows her stuff. And stuff I didn't even know. Like stuff I wasn't even seriously stuff I just wasn't paying attention to, like if my period's good, why would I? And I didn't specialize in women's health. I specialized in getting folks hormones balanced, but usually I was dealing with like perimenopause, menopausal women. So anyway, I'm glad to have you on because I think that there's a lot of listeners in my community who are either healthcare professionals themselves and need to hear this information. And also there are a whole group of young women who follow me who are having, very active menstrual cycles. And I think there's some things they probably don't know as well. So I'm going to just jump right in.
Okay, let's do it.
You have posted at length about the birth control pill and how it's causing a woman to have a fake ovulation, or there's no ovulation, or talk about that. Because I know you've gotten a lot of heat and it's been a fun source of text messages back and forth of like, oh my gosh, these women are not understanding this. So let's break it down for them.
Oh my gosh, I feel like it has been the driver for so many of our very good conversations over the years. And I think that, one of my biggest beefs with mainstream medicine and modern healthcare is the dismissal of the menstrual cycle and ovulation as these critically important components of women's health, no matter our age. And as such, in the majority of cases, women are prescribed hormonal birth control devices like the IUD, along with, really potent medications, as you well know, and life-altering surgeries. And they do this really quite casually. It's kind of incredible, the stories that I've heard over the years. And so much of this is based on the fact that research on women is severely lacking due to the fact that, we weren't required to be included in research studies until the early 90s. And so as a result, women's bodies really weren't studied. And to this day, we don't have adequate research. And so I feel like this has sort of led to an epidemic of women of all ages who are struggling with, any manner of women's health related issues, whether that's uterine fibroids or endometriosis or PCOS, or just chronically heavy periods or missing periods or whatever. So it's really, I think, just been downplayed. And so when women are prescribed the birth control pill so casually, as I mentioned, we're not taking into account this complex system, the hypothalamic pituitary ovarian axis, that entire axis where the brain is communicating with the ovaries. And then the ovaries are producing these really important sex hormones. And so I feel like it's almost dismissed. And we talk about this a lot in the women's health space, that we would never prescribe a pill to a man to just shut off his testosterone for an extended period of time. Whereas for women and girls, we are oftentimes putting them on the pill at like 11, 12 years old and basically telling them, okay, that's the solution for your painful periods or your heavy periods or your irregular cycles. And we're just sort of leaving them on those pills for decades at a time. And then there's this like major shock when they come off of it and they're struggling to get pregnant, or they're having fertility problems, or they're getting pregnant, but then they're losing those pregnancies over and over again. And so, not to say that like that's the case for everyone and that's the sole cause by any means. I don't think it is. But I feel like we're not even paying attention to that. We're acting like that has absolutely no bearing whatsoever on it. So I think ultimately, what we're lacking is an understanding that our periods are what we consider to be the fifth vital sign. And so this is just an indicator of how well your body is functioning. And it can provide insights into your hormonal balance, your reproductive health, and underlying conditions as well. And so when we have these regular, healthy, ovulatory menstrual cycles, they often reflect good overall health, whereas irregularities or significant changes that happen quite suddenly, particularly, can signal that something might be off. And so paying attention to your period can help you identify hormonal health issues early and really take proactive steps to address them, ensuring your well-being at every stage of your life. So if you want to get pregnant, you can get pregnant. Obviously, it's not as easy as that for some people, but I think when we have this understanding about how our bodies work, and we're not just going into these life stages, like trying to get pregnant, for instance, or perimenopause completely blindly, then, we're really ensuring our well-being. And I just think from a traditional medical perspective that the menstrual cycle has just been viewed as this bodily process that happens solely for reproduction, and that's it, and it's dismissed. And we end up really paying the price for that.
So talk to me about why it's so important that women have the opportunity to ovulate every month.
Oh, yes. Oh my gosh. Where do I even begin? I feel like, I think it's really important for us to remember that, like I was saying, right, your body, your menstrual cycle, your period is sort of like an early warning system. So it's going to sound the alarm if you need attention, and it's going to do that via various symptoms. And so the symptoms that are associated with your menstrual cycle, they don't mean that your body is broken or that it's not functioning the way it's supposed to. It actually means your body is responding in exactly the way it's designed to. And so when we think about these symptoms, right, that we all know that we're often prescribed the pill for, we were thinking of things like irregular periods or irregular cycles. And so that just means irregular ovulation, because when you're not ovulating consistently, your period does not come regularly. And so anything outside of that 25 to 35 day window, which is what I consider to be a regular length cycle, is often indicative of something else. It could be that you're under too much psychological stress or even physical stress, like a gut infection or something along those lines. It could be nutrient deficiencies of some kind. It could be PCOS, low ovarian reserve, even primary ovarian insufficiency, also known as premature ovarian failure. So there could be a number of things happening there. And yet, like I said, we're just put on the pill or some other kind of hormonal birth control and sent on our way, when in fact, it could indicate so much. And then with painful periods, that's another one that's so huge, especially the ones, that leave you on the fetal position in the bathroom floor kind of thing, or on the couch. That could be a sign of a system-wide inflammation, pelvic floor dysfunction, a condition like endometriosis, uterine fibroids, polyps. There are a number of reasons why you might have period pain, especially the severe type. And then things like heavy periods could be linked to fibroids, polyps, adenomyosis, which is a condition where the uterine lining tissue grows into that muscular wall of the uterus, and it causes it to thicken, kind of like a sponge. So you just get these insanely heavy periods every cycle. Low thyroid function, those are all linked to heavy periods. And then very light or missing periods oftentimes just means you're not ovulating. And there are a massive amount of reasons why we might not be ovulating and not making these sex hormones that we need to actually build up the endometrium every single month and then actually shed it. And so, we end up in this situation where not only do we have like a missing period, but we're having these side effects from the lack of having adequate estrogen, progesterone, testosterone. So like mood issues, skin problems, hairs falling out, energy problems, things along those lines. And so when it comes to ovulation, I mean, it is so critically important for so many things. And I think that what we fail to recognize is that ovulation, the actual act of it, isn't so important. It's what it results from it. And so that is the production of these key sex hormones. Estradiol in our reproductive years, that's the dominant estrogen, progesterone, testosterone, even other hormones like AMH. And then those hormones influence our other big time hormones like cortisol, insulin, thyroid hormones, melatonin. So everything's talking. And so when we're on the pill and we're not ovulating, we end up in a situation where we just take out the HPO axis completely, right? We take out all those hormones that are being produced by the HPO axis working properly. And so we end up with a lot of health issues potentially.
It's terrible. I tested every single woman who walked in my door for hormones for the most part, for most of my career, and young women, older women, you name it, men as well. And I rarely saw adequate progesterone production in a woman at any age, even young. And so it could have been any myriad of things, like long history of being on birth control pill, or maybe they were still on the pill. I mean, gosh, I cannot tell you the amount of women who went their entire lives on the pill and then take it into menopause. And then they're coming to me to help them transition from birth control to menopausal hormone replacement. And I'm like, oh my gosh, none of the signals have been happening. And one of the things I always think about with progesterone is it's a neurohormone. And so if you're not having progesterone released from that corpus luteum, you are essentially walking around potentially in a chronic anxiety, chronic sleep deprived state because you're not getting that wonderful progesterone on the brain. That's, it's an anxiolytic. It like chills you the F out. And I just walk around like I just want to rub progesterone on people. I'm not kidding. Every time a patient would be sitting there like shaking in their chair, telling me their sad health story, I just be like, I just want to rub some progesterone on you and it'll be okay. I mean, that's actually Pearl here. If you have a woman who can't stop crying, if you just rub progesterone into them until and this is not medical advice. This is something that I was taught by one of my mentors and I've used it clinically with great success. You just rub progesterone into them until they stop crying. Like you can titrate them up and get the tears to abate. And that's usually a cardinal sign that they need progesterone, amongst other things like heavy periods and others. So it's just crazy to me. I never tolerated birth control, so I never went on it, but I had terrible periods because I was an autoimmune hot mess of inflammation as a young person. And I was taught very early by my mentor, Dr. Rick Marinelli, that my period was basically like a sure sign of my overall health. Like if your period's awry, then something has gone wrong in the environment and we need to figure out what that is. It's not mask it with hormones, and then looking at women in my age group. And one of the reasons I wanted to bring you on here is because I know a lot of women listening to the show are in perimenopause and menopause. And they've never had good periods. And now they're dealing with fibroids and they're being told they have to have surgery. And I mean, these are healthy looking, fit women, and they just still don't have a really solid clue. And the way that women are treated at large is crazy. Like we're not acknowledged that we need hormones unless we're having hot flashes. By then I'm like, dude, that's your vascular system going bonkers. And there's young women having hot flashes, and then on top of that, they're still cutting women's ovaries and uteruses out like as an option. So it's like life of birth control because you had crazy periods because your health was a bit going sideways, but it was masked because you were on birth control. So you didn't know. And then you get all the way to my age and they're like, oh, we're just going to cut your parts out.
Or keep you on the pill.
Yeah. It's bonkers.
Through menopause. That has really gone crazy the last couple of years from what I've seen. The amount of women I've encountered who are in their mid to late 40s, early 50s, they have no idea what's going on with their cycle because they are still on birth control. Just that they were just put on it after their last child was born and that was it. And so they're on it. They're like 51, I'm still on it. And I don't know what to do. I don't even know what's going on, Nicole. Like, well, you might want to get off of it to figure out what's going on. And I'm always struck by this, but when we think about it from a cultural perspective or through a cultural lens, or look at it through a cultural lens, you think, okay, so the pill's been around since 1960. It's still the most popular form of reversible contraception in the US. like I think 30% or no, I think, yeah, it's like 16% or something, 16 to 20% of women are taking it. And, like I think about nearly 50% of them are taking it for other problems. So it's not just birth control.
Yeah.
So half of women on the pill are taking it for all these other issues. And I just think there's a fundamental problem with that. I guess, like, yes, popping the pill is a pretty easy way to prevent pregnancy. It's also a pretty easy way to address all of these health issues. And it's not dissimilar, right, to using it for blood pressure or cholesterol, that kind of thing. Using a medication for those two things is what I'm trying to say. And it takes more work to figure out the underlying causes, and the treatment requires substantial long-term changes in our diets and our lifestyles and whatnot. And so a pill that produces the same benefits is much more enticing. And I just feel like when you think back, there's an amazing study on the pill and how it became known as a quote unquote lifestyle drug. And I was so fascinated reading this thing because they talked about in the 80s, there was this distinct shift from using birth control pills solely for contraception to offering them as solutions for these, lifestyle conditions like heavy periods, irregular cycles, acne, mood problems, things like that. And the pharmaceutical companies didn't really want to keep spending all this money on research and development. And they were like, well, we can just repackage these things and sell them for all of these issues. Like I said, the PMS, PMDD, painful heavy periods, all of that stuff. And that has basically, I think, completely defined the way we prescribe these medications now. And women, unfortunately, are not offered any other options. And so I often think, if you were offered something else, would you take it? And I think they would.
I think they would too. I think the problem is it's there's a lot of work to be done, and it's such an important gauge of health. Like, you and I and Carrie Jones are all friends and we talk a lot. And every time my periods, well, let me back up. Again, what my mentor taught me was true. My period is a gauge of my health. And when my PMS is not pleasant, or like, I prefer a non-existent PMS that rolls me right into a simple, easy menstrual event, and I have normal bleeding and I buzz on through it a few days, it's maybe 5-6 days long and I buzz on through. When that's not happening, like, I still predominantly have that even at 50 years old. Like, I'm definitely on the edge of, I would say I'm probably in the middle of perimenopause. It hasn't really been that hard of a time for me. I've always had hard health conditions. So for me, I'm like, oh, this is just a different phase of it, but it's not the miserable experience everyone keeps making it out to. All these influencers online are like, it's so terrible. I'm like, not if you train for it and go into it fit. It's not that bad. Like, I've been on hormones since my 30s. Like, I was getting ready for this and I've been putting on muscle mass and taking good care of myself a long time. Like, I know you do this too, we're ready. But, when I get the terrible breast tenderness or the terrible PMS or the terrible whatever, it's usually a sign that I've been screwing around with my dietary habits, or I've been drinking too much, or I've been lacking on sleep, or I've been stressed out of my mind. And it's just, to me, it's like, oh, and then my period comes and it's not the pleasant, easy roll on through experience. But I think women it's become so normalized. They've always had terrible periods. And I have to just throw this in here. Young women today are not dealing with what young women, when we were young women, like the toxic burden in the world. And there's so many factors that I'm sure we could go on a long tangent about. So, your 13-year-old girl today is not what we dealt with at 13. But all that to say, they've just always had terrible periods. Either they just endured that and now they're walking into a terrible menopause and it's just a shit show, or they had terrible periods and that, like we just said, they get put on the pill forever, decades, and then come out the other side. And now they're trying to manage menopause. And it's really hard to manage menopause if you don't know your body and you don't know your cycle and you don't know what good health feels like. You don't know what's going awry. And that is a very difficult patient for me to manage with hormones, because I'm trying
and
to.
It's also, you don't know your norm. You don't know your baseline.
They don't. And yeah. I'm trying to get them feeling better on this whole orchestra of bioidentical hormones. And it's funny, hormones too low and too high look an awful lot alike when it comes to symptoms. And they're in their 50s. They're metabolically unsound. They're not lifting weights. They didn't prepare for this. And they want to feel good. And I'm like, we don't know what good is for you. because you've never allowed it. Like, we don't even know what normal ovulation feels like for you. Like, this is something you taught me. You're very aware when you ovulate, and you're very aware of the different phases of your period and what's going on with your body. And as you shared that with me over the years, I've started paying attention, and I was like, oh, I had no idea like why I was feeling this way had to do with this. So let's talk about that a little bit. Let's talk about some of the things that let's talk to the women who like me who haven't been on birth control, and I know my period because there's a lot of them listening. What does a normal ovulatory cycle, few days feel like, and what could we expect, and what are some of the symptoms of it not being quite dialed in?
Absolutely. I think this is such a great question because, like we said, right, who even knows this stuff and where would we even have learned it? I mean, I think that it takes a great deal of will and desire to find this information if you're not tapped into the world that we're all in. And so I would say I'll start at the beginning. So when you get your period, so your first day of your period is the first day of your entire menstrual cycle. And typically, I like to see a period somewhere between 3 and 7 days. Oftentimes, if it goes past the 7 days and it goes into the 8, 9, 10-day periods, and oftentimes I hear from women about they have like 12, 15, 20-day periods asking me if that's normal. I'm like, no, girl, that is not normal. And so if it's over 7 days, that indicates to me that your progesterone has not risen high enough in that second half of your cycle. I'll get to that in a second, to counter the effects of the estrogen. And so I call estrogen that builder hormone. It comes in, it builds everything out. Progesterone comes in and does the interior decorating and sort of smooth things out, getting ready for a potential implantation or a pregnancy. And so oftentimes, if your period is longer than that, it means there's some sort of imbalance going on there. And then also, those are often driving other conditions that make your period heavy or long, which are fibroids, polyps, endo, adeno, things like that. If it's less than 3 days, that means to me that you might not have ovulated. It means that your sex hormones are on the lower side. Something's going on there. Something is impacting your ovarian function. And this is something we should talk about too, like ovarian mitochondria, mitochondrial damage, all of that stuff, which we'll totally get to. But I feel like something's going on there. So 3 to 7 days. So now you get into that middle of your follicular phase. So that's that first half of your cycle, from day 1 of your period to ovulation. And so you've gotten through your period, you're like, yes, hallelujah, I did it. And now you have estrogen really starting to build up. Those little follicles on your ovaries are building and building, and they are producing estrogen. And that's telling your brain to slow down follicle stimulating hormone and increase LH, or luteinizing hormone. And so that hormone now is going to eventually surge. And it's going to lead to the release of an egg from a follicle on your ovary, and that's ovulation. And so at ovulation time, we've got now testosterone is peaked. Estrogen has had this humongous surge. It's the highest it'll be in your whole cycle. Typically, women feel really good around this time. Like, estrogen's high and life is good. We're seeing life through rose-tinted glasses. You have no problems. And oftentimes you have high energy. You tend to have a higher sex drive, which is always so nice. The ovulation surge is pretty great. And then also too, you want to just be out in the world. You're very outward in terms of your energy. You feel a lot more inclined to work out and do all of the things that, you would do when you're like peak energy. Your skin looks great. That's the thing with estrogen. It wants you to have sex. So your skin looks great. You have really good hair days. I'm actually ovulating. Isn't that great? So I can talk about all this stuff and be like, yeah.
You're like a goddess. I know. You're always like, I feel great. I'm ovulating. I feel like a goddess. And I'm like, really? I didn't know. I never pay attention to that. I just go from like bleeding into, am I having PMS? And then I'm bleeding again. I don't pay attention to the in between.
Well, Tyna, I feel like we're really conditioned to sort of like be stuck into the suffering of our cycles from the time we go through puberty to the time we go through menopause, right? It's just, we highlight the suffering. We don't. I mean, I think sort of the medical industry does in general. And so we're never really taught to see all of these incredible superpowers associated with our cycle. And I think that needs to change. So, once ovulation happens, your little follicle turns into, as you told us earlier, the corpus luteum that starts to produce progesterone. But again, like ovarian health, the quality of that corpus luteum, that follicle, all of those things play a role in how much progesterone you're going to produce, as well as your overall health. Are you riddled with inflammation? Is your gut a complete disaster? Do you have endotoxins just circulating throughout your body? Like, so much of your overall health is going to determine how healthy your ovaries are, because they're so susceptible to inflammation, to the effects of inflammation. And so then you start producing this progesterone, and oftentimes it's like a crossover almost. So estrogen drops precipitously, progesterone starts to rise, and a lot of women find themselves caught in that no man's land where estrogen has dropped so much and your mood just crashes, and you start to feel not so great from the time after you ovulate almost until your next period. So that's a good 2 weeks. It's not fun for a lot of women. And then when progesterone does kick in, you start to feel a little bit better. But oftentimes, like, there is that struggle for a lot of us. And then in that week or so leading up to your period, that's oftentimes where we see like the big changes in, our mood, our mental state, our patience, our outlook on life. The rose tinted glasses are definitely off. And I feel like progesterone is a little bit of truth serum. And you start to just be like, wait a second. And so oftentimes women are like, this is not, whatever's happening in my life right now is not working. And it brings up a lot of resistance. And so I think too, when you're thinking about that last half of your cycle, always think about how can you take care of yourself as best as possible and avoid as much external stimulation as much as you possibly can, because it really is, it is a time in our cycle where your body is literally asking you to slow it down and prepare yourself for getting your period. Because when you think about all these hormones crashing, and that's what happens. So your corpus luteum decides, okay, there's no pregnancy. It's done producing progesterone and estradiol. And it just, it sort of withers up. And then you lose all those hormones. And then of course, that's a signal to your endometrium to start shedding. And this is like an inherently inflammatory event, if you think about it, because estrogen, progesterone are potent antioxidant type hormones. They're anti-inflammatory or have those effects. And you lose all of that, and then suddenly you're just crashing. And so, of course, your mood plummets and you start to feel crampy and pain, and you have soreness, and some women feel like they get the period flu. So there's a lot of things happening, but so much of that is determined by your overall health. And this is exactly what we were coming back to, is what's your baseline? What's happening with your overall health that's going to determine how you experience your entire menstrual cycle?
Yes, absolutely. And that's a big conversation, that I think I've covered at length throughout my podcast, is how to dial in your health and optimize your health. But it's so many things. I think the real triggers around that period of time that you mentioned, for me, something you've taught me over the years, is to really pull back right before the menstrual shed. Don't overcommit. Don't be planning, like you said, don't be out in the world so much. And we can't always help it, but when I started paying attention to that, I'll tell you what, it was moving out to the farm, living on the farm.
Yeah.
Like, I quit wearing tampons. I quit using, I didn't care because I wasn't seeing patients anymore. I wasn't in a clinic. I'm just like out here, on the farm wearing my period. I love period panties, by the way. Like, you can buy
They're the best.
You can buy inexpensive cotton ones from off Amazon, and they don't have to be the ones that have I know there was a lot of controversy with some of these that had maybe, PFAS or
PFAS.
in there.
Yeah. Yes.
Yeah. So I threw all those away, and I just bought some cotton ones off of Amazon, and you have to change them frequently. And it's definitely not something I could wear and go to work. But if you have the opportunity to not go to work, it's pretty nice just to be able to bleed, first of all, not plug it up. And then being out on the farm, I'm really cognizant of sunrise and sunsets, because I can see, because I don't have buildings all around me. So I can look out at the mountains and see the change of the light. So my circadian rhythm got more in sync, but my periods really mellowed out. And I'll tell you what screws them up. It's when I go out in the world, when I'm not supposed to be in my luteal phase. It's when I am drinking alcohol, or and it can be just the tiniest amount for me. Sometimes it just sets everything. Or it's so funny with Carrie Jones, because I'll be like, I'm having these symptoms. And she's like, it's the wine, Tina. It's the wine. She just sends me a little wine emoji. And I'm like, damn it.
Wine emoji.
Damn it. So I mean, just even the littlest bit I don't have the tolerance bands as I get older that I used to have. I can't push it as far. So even one glass could be too much. And then am I getting adequate, something my mentor, actually his resident, his first resident way back when I started working for him way back in the mid 90s, she said, just make sure that you get a steak in you, a big, medium rare steak in you right at the end of your PMS or right on your first few days of bleeding. Just get a big old fat steak in you and your period will be so much better. So I subscribe to that and that really helps me as well. Not that I would eat steak any day and I try, but I just make that's like a thing. My husband takes it very seriously. So there's ways to mitigate it, but I used to have gnarly PMS. Like I would go crazy. Like legitimately, when I was in college, high school, college, I would go crazy and nobody knew what to do with me. And so antidepressants were the solution back then because I didn't tolerate the birth control pill. But it's one or the other with young women, and they still pull this shit with older women is, I guess my point is where I'm trying to get to with this. It's like, I'm still talking to older women who are still dealing. They're like, well, now, they're having like perimenopausal stuff. They don't know their baseline because they've probably been on the pill their whole life, or they've had terrible periods and nobody ever helped them. And then they get to my age, or like you said, mid 40s to up into mid 50s. And they're getting doled out antidepressants. It's nuts.
It is criminal. It is criminal. And when I think about PMS, PMDD, and so for anyone who doesn't know, PMDD is premenstrual dysphoric disorder. So it's the bigger, badder version of PMS, I suppose you could say. And it's an actual psychiatric disorder, or it has been classified as that. And so it's actually listed in the DSM-5. And there are very specific diagnostic criteria for it, which requires you to keep track of your symptoms. And before we even go down that whole rabbit hole with my clients, I want to know, when did this start? How long has it been going on for? Was there a trigger for this? I had a really good friend many years ago who she'd started a startup, for lack of a better way of saying that. And she had, huge investors and tons of money on the line, and it was doing well for a long time. And then it started to decline and they couldn't figure it out. And she eventually had to sell it at a loss. And obviously that was an extremely stressful situation for her. But I've known her for like 15 years now, and she'd never once talked to me about PMS or PMDD, did not have those issues. And then in the midst of the really hard parts of dealing with her business, she starts telling me, I think I have PMDD. I'm like, do you really? Is that what's going on? And again, this isn't to discount someone who does, because it absolutely exists. There's no doubt about that. But I think that we're using these diagnoses instead to compartmentalize women into these boxes instead of really looking at the contributing factors, because we well know that your menstrual cycle is highly influenced by external and internal factors. And so eventually she, like I said, she sold the business. And when she did, the symptoms completely disappeared. And so I always encourage women to really be an inquiry about what exactly could be contributing to this, what in your life is not working, because there's no reason. Like I said, there's progesterone is that truth serum, estrogen makes you see the world through the rose tinted glasses. So there's no reason why we should all turn into absolute basket cases in the second half of our cycle. I just can't believe that our menstrual cycle, our bodies were created this way, that they were just so flawed that this is what happens to us and we should just expect that.
I totally agree with you. And to add to what you said, I always share with patients, they'll come in and they'll say, I have this diagnosis and this diagnosis and this diagnosis. And I'm like, well, I'm not going to add to your list because I'm not interested. I'm interested in the symptom picture you're presenting with, absolutely. But I'm much more interested in the cause of that and why homeostasis is out of whack for you. And my job is to get you back to homeostasis as best I can. So diagnostic codes are not that interesting to me. I'm much more interested in the person presenting with a weird symptom picture. And like you said, we are using these, it's a dismissal by the medical system. Like we have to, as doctors, just to clarify, doctors are required to diagnose. It's called the privilege of the diagnosis. Health coaches don't have it. Nutritional therapists don't have it. Doctors have to ascribe a diagnosis. And then unfortunately in the allopathic system, they are required to abide by the standard of care. And the standard of care is written by organizations and they come out with position papers. And that might include X, Y, and Z. So if she checks off the boxes for PMDD, then they are required to offer the antidepressant or whatever it is. And naturopathic physicians, licensed naturopathic physicians, we don't have to abide by the standard of care. We just have to abide by best practices. And I 100% would agree with you. I would be like, how's your stress? How's this? I mean, people really underappreciate stress and what it does to your hormones. It sends you sideways and upside down and all around, but I think that we can have all the diagnosis codes in the world. And a lot of people like to really hang their hat on them. They're like, I have this. And they wear it like a badge of honor. I used to be that way too. Like, I have this. And that's how I define myself. And now I'm like, fuck that. What am I going to do about it? And I tell patients, I'm like, okay, great. You have all these, like, they're like, I have bone on bone. I have Hashimoto's. And I'm like, okay, well, what are we going to do about it? Like, great. So you have a diagnosis. I hope that makes you feel better, but that doesn't change the treatment any. We still have.
That's what I tell women all the time.
Yes. Like we still have to, you sound like a nature. That's why Carrie and I love you. Cause you're like our bona fide naturopathic friend. We'll give you there's so many fake NDs out there. We'll just give you like the real one. But it's like, you still have to get your shit together and do all the work to mitigate the symptom picture at the end of the day. So who cares what the diagnosis is? Not to discount it or dismiss it, but like, what are you going to do about it?
Well, it's so nice, right? After so long, you get a diagnosis, you get a doctor who's listened to you and actually has follow through and isn't just dismissing you. And I totally understand that. And at the same time, like you said, it does not change what you have to do unless you're going to take a medication, which, you are more than welcome to do, of course. But that's definitely not our wheelhouse. And that's not what we're all about. So it's interesting what you were talking about with melatonin and you didn't say melatonin, but you mentioned sleep and your circadian rhythm and all of that. And I think that that's like a big one for women with regard to, their menstrual cycles. And it's just like one little thing that we underestimate, just like stress. I had a woman tell me on Instagram the other day that she was on vacation for a week with her family who she doesn't totally get along with, and her ovulation is delayed. And she's like, I usually have 27 to 29 day cycles and not this cycle. And I said, that's literally all it takes sometimes is just, a weekend with the in-laws or something like that. And so, that, and then the sleep piece, I didn't learn when we were younger that I should sleep, that it was important. No one, who the hell told you that? Nobody ever told me that.
You were really praised if you didn't need sleep the way we grew up, right? Like you were cooler if you were like, oh, we only do 3 or 4 hours. We're better than you.
Yeah. Sleep when you're dead, like, oh, go to sleep at 1 a.m, get up at 6 a.m, go to work or go to school or whatever. No big deal. And when you think about melatonin, there are receptors for melatonin on your ovaries. And so this hormone obviously not only regulates your sleep-wake cycle, but it also plays a role in your menstrual cycle. Plus, it's a super powerful antioxidant. And it has effects on ovarian health. It's so fascinating to see that. Like women who do shift work, for instance, they have disrupted circadian rhythms and they experience longer menstrual cycles and heavier and more painful periods than women who work daytime hours. So there are all of these pieces and components that we just either don't know about or we just greatly underestimate. And, and that plays a huge role in fertility as well. Like, even melatonin and fertility, like their lower levels of melatonin affect healthy follicle development and play a role in fertility problems. And then on the flip side, high levels, if you're supplementing too much with it in many cases, can prevent that LH surge from happening. And oftentimes you're supplementing with it because you're not dialing in your sleep hygiene and addressing that from a foundational perspective. So that's just like one little thing that we could do that would help. And we don't even know that it's playing such a huge role.
That's so interesting. Yeah. And a lot of folks have low melatonin, a lot. And low melatonin, there's a strong link between low melatonin and cancer. And there's a very strong link between shift work and cancer. And they're the estrogen driven. Well, I shouldn't even call it estrogen driven anymore because I think that's been sort of put to bed, but they're the, estrogen receptor types. They're what I call the sex cancers, the ovarian, the breast, the prostate, like the hormonal types of cancers, and we need melatonin. So yeah, I'm such a baby now. It's like 9:30. I take melatonin, and if I do, I'll just say this: melatonin is amazing. It is amazing. But I'll tell you what I learned in school, and I was so glad that I learned this when I did, and I've carried this through. Take the lowest amount possible. Like, try to find the 1 milligram pills if you can, and take the absolute lowest amount possible, because we don't want to go crazy above physiologic dosing. I like to microdose everything, as you know, Nicole. So like, I microdose anything I can microdose to see if it works. And I feel like you get phenomenal impacts at very low doses, and you get sedation and pharmacological impacts at really high doses. So whatever people need to do, but take it like when this light starts waning in the sky. This is what I was taught by this awesome guy that came to Grand Rounds, a sleep expert, like 7 p.m. when the lights are getting low. That's when you take the melatonin, and you just keep that dose super low. Be very careful with children. And like you said, you can really screw up your menstrual cycle with it. So awesome. But the milligram pills I see in the store are like crazy high.
Oh, it's shocking. I can't believe the amounts people are taking. I agree with that completely. I always say, if you feel like this is something that you have to take or you want to take, definitely do the lowest dose possible. I think I do like less than 1 milligram a lot of the times. I just use a spray, and so I'm just gauging what I'm taking. But I love the spray. It's easier for me. But yeah, I find that it's really potent. And then a lot of women that I talk to have really vivid dreams and have nightmares and things like that. And I say to them, okay, maybe that's not for you. And so that's the other thing, right? Is I know we talk about this a lot too, but just this idea that, well, this guru is doing this, or this person's doing that, or my friend is doing this, or I read this woman said this in this Instagram comment, so that might work for me too. And it's just a lot. I think women are just burnt out on guessing what to do for their health. And so I always think that it's really important for us to remind women to actually seek help from someone who knows what they're talking about, whoever that is, because it just feels like they're just so exhausted by trying to figure out what to do for themselves by like seeing stuff online or listening to a podcast or something like that.
You make a really good point. And I think that when it comes to the nuances of like, we're getting granular here, a lot of women that come into my DMs, like they think it's the one thing. Like there's a lot of folks right now who think the GLP-1 is the one thing. Or when I was talking a lot about testosterone years back, that was the one thing. Or it's progesterone or it's estrogen. And I'm like, it's usually all of it. So when we're going to get granular, find somebody to work with. However, that said, there are these generalities that everybody must abide by as a human being to be healthy, right? Like there's just some ground rules that everyone needs to address, which is their sleep. You mentioned that. Their nutrition. They need to exercise. They need to, act like human beings are supposed to act, not like weird blue light stricken, strange lab rats trapped in cubicles and under fluorescent lights all day. Like that is not how we thrive, nor do our hormones or our menstrual cycles. So I know there's so much more to this. And you recently launched your membership program, which I really want to get inside of because I've been listening to you talk about building it out. And like, there's just some like generalities that people need to know if they want a good, healthy menstrual cycle, right?
Totally. I mean, obviously sleep is one of them, like we were just talking about, and that whole melatonin, cortisol, equation. But like one of the biggest things, and I know you talk pretty extensively about this, is blood sugar. And I know that this is not sexy at all to anyone. And I get it. But as you get older, ladies, trust me, it becomes super sexy. But, one of the things that a lot of us don't realize is how the menstrual cycle and those sex hormones influence blood sugar and insulin. And so when you think about that first half of the cycle I was talking about, the building of estrogen, that higher estrogen in the follicular phase correlates with increased insulin sensitivity. So basically it means that insulin works better, or we need less of it, to control blood sugar in that first half of our cycle. And then around ovulation, insulin sensitivity starts to decrease because of that drop in estrogen post-ovulation, and then progesterone rises. And then Insulin is actually higher generally in the luteal phase, and higher progesterone seems to affect insulin sensitivity a bit negatively, unfortunately. And so it causes a bit of an increase in insulin resistance, during this phase of the cycle. And what this really means is that we're just more prone to blood sugar swings, the hyperglycemia to hypoglycemia, and we're more sensitive to those drops in blood sugar in that second half of the cycle. And this, of course, creates mood symptoms. It creates changes in our weight, which are some of the biggest concerns that I hear from clients. Women, in every single survey I do, whether it's on Instagram or to my community via my mailing list, they say their mood symptoms are the biggest concerns. And I constantly think about the incongruence of our biology with this modern world. It's not great. And as you said, right, moving to the farm really helped. And it does, moving away from all of these external stressors. But coming back to that, I just want to again remind everyone, your body is not rebelling against you, right? It's not that it doesn't want you to feel good in your cute swimsuit or fit into your jeans or whatever. It's that you're primed for making babies, and insulin plays a really vital role in every stage of that process. And, when you think about the first half of your cycle, your body is directing all this energy towards building up that uterine lining and the maturing follicle, and it comes from glucose. And so that insulin sensitivity helps sort of direct that glucose to those really energy intensive activities that are happening in your body. And then in that second half of your cycle, it supports energy storage in the adipose tissue, because you might be potentially pregnant and you need that energy storage for a potential pregnancy. And our bodies, we've evolved over like hundreds of thousands of years, and they're really, really smart. And I feel like we just constantly are working against them, or working against our biology. And so just like I said, the blood sugar piece, I think, is so, so crucial, because when we can actually start to get that under control, that changes so many things.
That's the key. That's the key. And the thing that women, I don't talk about this much online because it's a lot of biochemistry, but we're always talking about insulin sensitivity and optimizing the insulin receptors. But what nobody's talking about is that we have these other independent pathways that are insulin independent, the AMPK, the SIRT1, that lead into PGC1 alpha. And those are stimulated by exercise. Those are stimulated by caloric restriction. Those are stimulated by GLP-1s. It's like there's this whole other world of getting glucose into the cell appropriately, like creating, like I think of, muscle specifically, but muscle cells, but cells in general, they are a glucose sink if we do it right. So don't eat so much that the body can't handle it. And then what you do eat needs to go in efficiently. And it can't just be about doing low carb. Everybody says, oh, I've got blood sugar issues, I'm going to go low carb. I'm like, okay, that inherently can bring about its own issues over time. But that said, that's just like, to me, 1/3 of the equation of getting glucose into the cell. And we need exercise. Exercise is our most potent tool to get glucose into the cell from insulin independent means. And exercise and being well muscled is our absolute best tool to making sure that our hormones are balanced, and having muscle and good physical fitness going into menopause. Because as our estrogen drops, I just did a podcast about this. As our estrogen drops, we are going to go into metabolic dysfunction, whether we like it or not. And so we have to be armed with good physical fitness and muscle going into that. That's why we have to train for menopause. It's not negotiable, because women are going into menopause completely unprepared, and they're like, I don't know what to do. And then they're being given menopause cream or whatever, or a patch. And I'm like, dude, like they're missing the whole freaking point. And it's crazy to me. And I realize I just rattled off a lot, but there's so many inherent reasons why I don't care how people exercise. I don't care what they like to do. It doesn't matter. Do whatever you want. I think it's great as long as you're moving. Do definitely pay attention to muscle though, because it's got its own set of unique, wonderful assets that we need. Think of this like a portfolio. Like you want your portfolio as rich as possible as you walk into retirement, right? So it's the same with our health. Like if you're not really dialed in by 35, 40, you've got a lot of work to do. And so this is where your expertise has been really valuable for me, and where I think people need to pay attention, especially younger women who think, oh, it's no big deal. It's a big freaking deal.
It really is. It's such a big deal. It's such a big deal for the younger women, for fertility. We were talking about this before we started recording, the fact that, right, like you just, kind of think, okay, well, I'm just going to go on the pill and then I'm going to come off of it in 15 years and I'm going to get pregnant because that's what my doctor told me. But the more research that comes out now about the effects of the pill and what it does to, every aspect of our health. And again, there are lots of people who take the pill without incident. So I get that. There is that. But there are a lot of us who don't. I am one of those people. That is why I actually do the work that I do. And, and I think that that is such a flawed way to approach our bodies and our fertility and our health. And I just can't believe that there's just no connection, right? There has to be some connection to our soaring rates of infertility and being on these synthetic hormones that have not only an impact on our ovarian function, obviously it's stopping ovulation, it's its mechanism of action, but the pill has so many other effects. I mean, there's now research to show that it has an impact on, our gut, our liver, our gallbladder, our thyroid, our adrenals, and our stress response, our nutrient stores. So there's so much from gut microbiome composition, to intestinal permeability, to our, gallbladder function and bile production. It's kind of insane to think about it. And the amount of young women I know who've had their gallbladder taken out and it was because they were on the birth control pill is astounding.
Yes.
And so I think, right, we have to really consider this stuff before we make a decision to just be on this medication that is not without side effects for most people, for extended periods of time. It just wasn't designed to do this. It wasn't designed for us to be on it for these long periods of time.
And if you don't have your gallbladder working, and your bile production happening, you don't absorb your fat soluble vitamins, which are essentially acting as hormones, and you don't get your A, your E, your D. It doesn't get in. So it's a disaster. See, I would see these women in my practice they were hitting middle age and it was hitting them like a train, like a complete train wreck. And I was like, oh geez, like I wish somebody would have done intervention 20 years ago, because this is going to be a tough one. This is why I tell people, get your shit together.
I know, right? There's no other way to say it, ladies. Literally, that's what you have to do.
Well, so
I know, when you think about,
go ahead.
Go ahead. Sorry.
You go.
I was just thinking about just from a thyroid perspective as well, how many women do we know with thyroid problems? And so much of it links back to being on the pill, right? It potentially disrupts your thyroid function, causing these hypothyroid symptoms in so many women that I have worked with over the years or encountered over the years. There's an augmented response to thyroid hormones. I can't even begin to tell you how many girls in their late teens, early 20s I worked with in the beginning who were on the pill, and then 2-3 years into it, they suddenly have a thyroid problem and they need to go on thyroid medication. And I was like, wait, we hold on a second, what's happening here? And so, again, we're just never taught that all of these bodily systems are connected to each other and they all depend on each other. And so then we turn off ovulation, but we need progesterone in adequate amounts to make adequate thyroid hormone. And we need thyroid hormone for our ovaries to work properly and make that progesterone. So we turn off one and we cause problems with the other. And I think that should be a big takeaway for a lot of people.
That is such a good point. Yeah, everybody has thyroid issues. I mean, everybody.
Everybody does.
People would come into my clinic and be like, I have Hashimoto's. And I'd be like, join the club, lady. join the club.
Right.
Because let's talk about that a second. When you take this birth control pill, anytime there is a big surge or shift in your hormones, your propensity to have your autoimmune gene turn on occurs. And so this is common in pregnancy. This is why a lot of women, myself included, I did not come out of pregnancy well. That was a rough 10 years afterwards, because I dropped immediately into a more severe flare of autoimmune disease, i.e. Hashimoto's and a bunch of other things. And another big one is starting birth control pill. When people start on birth control pill, that will often be sort of the first trigger that gets the autoimmune system rolling. And then you are messing with your gut microbiome, like you mentioned. And so it will often sort of fast forward them into leaky gut. And it's a whole thing. And this is so important when it comes to fertility, because all of these you have to have adequate thyroid hormone to sustain a pregnancy, and you have to have a good healthy microbiome to sustain a pregnancy. And these are the endometriosis, is it autoimmune? Maybe, kind of. I treat it like it is. Also, it's an infection, they're saying now. Like, there's specific bacteria they're finding in these uteruses. So we don't want to get our microbiome all screwbally. But that takes us into fertility. And something that, and I know you know this, but something I've been aware of a long time, long before it was ever talked about online, was the idea that when you're on birth control pill, like, this blew my mind. The implications for the human race is like, this is monumental. When you're on birth control pill, your sniffer is off. So when you're not on birth control, you tend to sniff out mates who have the opposite immune system as you, so that you don't potentiate autoimmune disease and genetic issues. You actually sniff out somebody whose immune system is going to complement yours and help balance it. So if you have children, your kids aren't having these, you're not doubling up on the autoimmune disease, so to speak. And birth control messes up your sniffer on that, right? Like, this is a disaster for the human race. And I've been trying to tell people about this for so long. And I know that you've talked about it. Jolene Brighton's talked about it. And it's like, this is.
When I first heard it, Tina, I couldn't believe it.
I know.
I've had men email me and say to me, my fiance or my wife has come off of the pill because we're trying to have a baby. We just got married a year ago and she doesn't want anything to do with me. And we're like on the verge of divorce. When I first got like that very first email, it was a guy, it was probably 12, 13 years ago. I was shocked. I had absolutely no idea. So of course I'm digging up research, trying to find something. And then I found that research and I just couldn't believe it. I was stunned. And subsequently I have had countless women and men reach out saying the same thing, something along those lines. I actually had it happen to a family member. His girlfriend came off of the hormonal IUD and she was like, I just can't be with you anymore.
Because
it's unbelievable.
They meet them when they're on it. But then let's double down on this for a minute. Think about the implications to the offspring's immune system. Absolutely. And we wonder why we're seeing
the human race.
Yeah, we're seeing these crazy high rates of autoimmune disease. We're just seeing a lot of things we don't need to go into that are pretty devastating that young children are dealing with. And I wonder how much of that has to do with people picking the wrong partner when their sniffers are off. And I had patients do the same. Women would, I ended up early on in practice, I was working in a clinic with a chiropractor who specialized in postpartum. And so I ended up doing like all their hormones and gut health. And many of these women would say, I can't stand my husband. And at first I thought, oh, it's just their postpartum. And I had a really hard postpartum. So I thought, oh, maybe it's just that. And I started paying attention. These were the same women who had been on birth control, went off to get pregnant. So they were only off for a shorter period of time, got pregnant, and now they're in their normal cycle and no pill, and they can't stand their husbands. And I'm like, oh my goodness, this is a thing for real.
I know it's so shocking when you first encounter it and you just can't even believe it, but it definitely exists. And then not to mention the potential nutrient, issues that you run into with the birth control pill, whether that's because it affects the microbiome and affects, potentially creates leaky gut. But nutrient absorption is such a huge issue with the loss of the B vitamins, particularly. This is why I tell women, if you're going to come off the pill, just come off of it. And literally, at least you need 6 months to get things back in order. Because like B2, B6, B9, which is folate, B12, these are all essential for, a wide range of things, but reproductive health is one of them. And, vitamin C, vitamin E, the minerals like zinc and phosphorus, those are really big ones as well. And those are all, not phosphorus so much, but the rest of them are so crucial for ovarian follicle health, for egg health. And if we're just, constantly depleting ourselves, it's very difficult to get pregnant in many cases and then stay pregnant. The staying pregnant part is, I think, something that we tend to overlook. And Lisa Hendrickson recently came out with a book titled Real Food for Fertility. And I was just chatting with her about this on my podcast, where we were talking about the fact that there is research that shows that women who've come off the pill have a harder time getting pregnant than women who were not on the pill. And so it takes a longer period of time. So it's really fascinating. And I feel like more of that will come out, but it's just not well known, I think.
Well, and those B vitamins are so critical for so many things. I mean, they're like
Yeah.
the list it's a laundry list. So even
DNA.
yeah, even women who
You know?
aren't interested in fertility are potentially looking. I mean, like I said, they made me crazy. Like I tried
Yeah.
3 different times in my youth to take birth control pills in college, and all 3 times I went batshit crazy within a matter of, weeks. And I was so grateful. My doctor actually I wanted Depo-Provera. Do they even have that around anymore? I feel like it's not as
Oh, yes,
popular.
girl.
Oh,
Oh, no, it's not as popular, but they still have it. And what's even crazier is it's the majority of women who take it are minority women and poorer women. And it's very difficult to deal with the side effects. Like oftentimes women are just bleeding constantly on it because it's a progestin only. And not only that, and so progestin only thins out that uterine lining so much that you're just like constantly bleeding. And the other thing about it is that when I did the research on this, I was so stunned. I didn't realize you could only take it for a certain period of time. Mm-hmm. It's only recommended for a short period of time, but women are on it for years on end. They have massive bone loss from this type of progestin. And I just was astounded by it. The fact that you're only supposed to be on a short period of time. I think it's like a 2-year max. And I've encountered women who are on it for like 5, 7, 10 years. And they, they end up with osteoporosis.
How awful.
It's insane.
It's well, my doctor gave me the pill version and it made me crazy. So I went off of it. And then I was working in a community clinic in medical school, and we were serving the underserved, and a lot of homeless women would come in and get the Depo-Provera. For people who don't know, it's like a injectable insert. It's like a pellet, if you will, and it's progestin only, and it's really imbalancing to your system. And so they would get put on this over and over again too. And I knew a bit about it. I didn't know what you just told me, but I knew it was not great for various reasons. And it just broke my heart because, like you said, it's usually folks who don't have the money for something more. And back then, you couldn't get an IUD without it costing a ton of money, And then there's the the Mirena, which that made me crazy. I literally pulled that out.
It did.
I was in chiropractic college, and I went in the bathroom, and I was like, "Fuck this!" And I pulled it out. I pulled out my IUD by myself in the bathroom because I was like, and I'm not suggesting people do that. That was not painful for me, but at the time I was like, that was probably not a good idea to do by myself. And
well, you're not the only woman who said that to me. Yes, and I've heard this story a few times.
I was like, this thing is making me nuts. And I kid you not, within 24 hours, I was significantly improved in my mindset and my mental state. So that's a heavy progestin only too, isn't it?
It is. These progestin only birth control pills are so insane. Obviously, there's like there's a few things. The first is hormonal birth control definitely has an impact on the HPA axis and your ability to handle stress. So when you think about that, like, okay, so your coping mechanisms drop down. And so you suddenly you just can't handle stress as much. So your stress response is totally dysregulated. So of course, like if you're faced with things while you're on these forms of birth control, you end up feeling like totally crazy and you can't handle it. So you're just sort of like shut down. And then on top of that, progestin has a humongous effect on our brain. I mean, these are the side effects that we talk about. Yes, there's potentially the fertility, but the mental health piece is so huge. And like you said, right, the symptoms of low progesterone and high progesterone look awfully alike. It's the same with the progestin. If you're on a low dose progestin, you have the same mood issues. When you're on a higher dose, like say the birth control shot or like the IUD, where these things are implanted in you and they're going to release a significant amount more of the hormone in the initial months, and then it starts to wane over time. You're going to have these like massive side effects, these massive mental and emotional side effects. So what you said about pulling that thing out, I've had so many women tell me the same thing. They just had to because their doctor wouldn't do it. Their doctor literally wouldn't take a device out of their body.
Really? Wow.
Yes. Yeah.
That's
heard that so many times.
I have
Absolutely not.
I have had a IUD in that's copper with a little bit of plastic, non-hormonal, and I've had that. It's from Canada. I got it in Canada, and
Oh yeah.
yeah, it's called the Flexi T Matrix. It's tiny and it's awesome, and I've had it forever, and I've had it longer than I should at this point. But there's enough, the copper. They say they have to tell you that you have to take it out after this many years. But because the Paragard in the US is copper, right? And it's quite large. I tried that one. It was too big. Even though I've had a baby, it was too big for me. Anyway, my doctor and I have decided my risk tolerance is thus that we are comfortable with the copper component of this IUD in protecting my because who knows? I mean, I don't think I'm too old to get pregnant. I'm pretty healthy. I have pretty normal cycles, and my husband's very healthy. So it's still on the table. I don't want to be, but
anything's possible.
I'm leaving that IUD in because we just kind of decided, well, she thought years ago, she's like, well, you're walking into menopause. We'll take it out when you're through. And we're like many years later. And she's like, girl, are you just keep going? I'm like, yeah, just keep going. I'm
keep going.
I'm like a goat.
I'm in awe. Yeah, that you are still having regular cycles and everything. That does not happen.
Well, pretty close. They get a little funny. They got a little funny after COVID, and they got a little funny with the GLP-1 at first, but that regulated out really nicely. And I mean, they're hit or miss every now and then. And I'm starting to even predict it. But if I take good care of myself, I'm telling you, the ticket is staying fit. This is, even if women had disastrous diets, although fit women tend not to, the ticket for young women, middle-aged women, older women, anyone listening, the ticket is, and I have so much data to back this up, is to stay fit. Your periods will be so much better. There's a lot more to it, I know, that you teach inside your membership, but I just decided years ago, because I was a train wreck, Nicole. Like, I was a complete and total train wreck of health. And my friends who knew me back then are like, you're what now? You do what? You're a naturopathic doctor and I'm like, dude, and I'm crushing it at 50. So I figured something out. And I will tell you this, I got off sugar when I was like 14, and I started exercising like it was my job in my 30s. Not too much. Not overdoing it, not highly oxidative exercise, not running marathons, not any of that, not CrossFit, nothing crazy. I just started significantly committing to a couple days a week of lifting, walking, and just moving my buns around, just.
I do that too. I know. Everyone's like, you're turning 45. I'm like, yeah, I'm turning 45. Like you, I also have regular cycles. And, there's some hardcore PMS-y days, whatever. But, I know why that's happening. I think that's the key, right? Is that you should really know why this is happening. You shouldn't just be caught off guard constantly by your moods or you're bleeding out all over the place and you don't know why. And so I think that that's really, like you said, it really does take consistency. And I feel like we're broken records and we're so boring, but it's really just true. And, coming back to, we were talking about ovarian health. I was talking about that when I was saying the different phases of the cycle and how dependent your whole period and your hormone production is on the health of your ovaries. And those little ovaries are like these little mitochondria powerhouses. And, there's amazing research out there. So this is the other thing, ladies, that research exists out there to support everything that we're talking about. You're just never going to hear it from your conventional medical doctor, no matter how many times you go back.
Yeah.
Just letting you know, because I hear this all the time. I just keep going to my doctor and I don't get anything but the birth control pill or an IUD, or I'm told to just get my uterus taken out for my fibroids or my whatever. And I'm like, okay, there is a better way, right? But it requires you to become the expert on your body. You're the one who has to kind of become your own doctor. And, when you think back to your little ovaries, they don't like inflammation. Like we were talking about blood sugar. A high blood sugar state, is very pro-inflammatory. You don't want that. Your ovaries definitely don't want that. And they're going to respond. And so when you think about ovarian health, think about antioxidants. It's amazing. The research shows how metformin really helps with improving mitochondrial energy metabolism. And I'm like, of course it does, because it stabilizes your blood sugar. But, CoQ10, vitamin C, vitamin E, vitamin A, the same fat soluble vitamins you were just talking about with your poor little gallbladder and your bile. like melatonin, we just talked about that, L-carnitine, quercetin. These are all amazing antioxidants that you can find in your diet. You can also take supplements, it helps. And that will support your ovarian health. Women ask me all the time, how do I preserve my fertility? Doesn't the pill preserve my fertility because I'm not ovulating every month? I'm like, no, the pill drives up inflammation and your body literally hates inflammation. Your ovaries hate inflammation. The way you preserve your fertility is to pay attention to your cycle, track it, and know when there's something wrong and course correct when you think there's something wrong based on the fact that you know your body. So that's really it in a nutshell.
Amen.
I'm stating the obvious.
I love the start of that. You're like, we just really need to, we should know. You're so right. We should just, but people don't. And this is something I talk about with even inside my program. It's like the whole point of my program is to educate yourself and to become empowered so you can be your own best doctor, and you can be empowered through education. So when you do go have a conversation with your doctor, you walk in prepared and you walk in with that shield of knowledge and those studies in front of you if you need to, and you have a good conversation with somebody who, doctors, we're not over here just to write prescriptions and explain stuff over and over again. We don't have time for that. When patients come in and they're really well educated on a topic and they present information to me, I'm so open to it. I'm like, oh, this is great. You did the research for me. Thank you. I'm very open to hearing what you're interested in doing. And I'm more than happy to meet them where they're at. And very often I will prescribe things that they're asking for in a responsible way and track them with labs and make sure we're doing everything by the book. But I've learned more from my patients than you can imagine. People coming to me with really good knowledge bases, and they teach me things about hormones, and they teach me things about all different types of conditions. And it's a working relationship. That's what you should have with your doctors, but you have to come in educated. And I think that's where you really shine. You have a program for practitioners, right? And you have a program for the public. Tell me about that.
I do. Yeah. So program for practitioners is the Institute for Menstrual Health that I founded. And I really fundamentally believe that coaches particularly, they want to understand these hormones. They want to understand menstrual cycles so that they can help their clients do exactly what we've just been talking about. And so that is, that's a separate thing. And then I have the Fix Your Period Collective for the general population. And this is like a first of its kind platform. It's something that I've been working on, as you've heard, over and over again for 2 years now. It's been a long time coming, but I really wanted to create something that made sense for people. And so they take a detailed period quiz. The results calculate themselves right in front of you. You're transported to a period dashboard. All of your results are just populated on the dashboard. Everything's clickable. You can see not only what your results mean, but you get a period score. There's a bell curve with how you compare to everybody else. Yeah, and so that information alone is more than you'll ever get at a doctor's visit. And that's what I keep trying to say to women, that you cannot keep taking your body to the doctor like you take your car to the mechanic or your Apple laptop to the Apple guy down the street, because God knows I have done that so many times. And I just feel so strongly that you have to get educated. You have to figure this out. And so just doing that is just never going to work. And with that, we have protocols for all the different period problems you could ever imagine, recipe room full of recipes. We have a community. We have an entire course in there as well. I talk a lot about blood sugar. I just finished that module. And so there's a lot of thoughts on that. And so I feel like, again, if you can start to just get educated, even if you just start to track your cycle and you just do that as the basics for, a couple of months, that can be a whole game changer, because that will give you more insight than you will ever get, like I said, at any doctor's visit, because no one's going to ever know your body better than you.
Amen. I agree. I think it's awesome. You showed it to me as you were building it out, and it's beautiful. It's really easy to navigate, and you're just an incredible resource. Every time I've heard you speak on something, the amount of knowledge that comes out of your mouth and how you tie everything back together is so beautifully done. People could learn a lot. You also have a book. I did not pull it out. I was going to pull it out and show it on the video, but I don't have it. Do you have your book with you?
right
there it is. Fix Your Period. Hot pink. Great book.
Yes, very bright. Oh my God, very bright.
Yeah.
Yeah. And, and that, again, same thing. My goal with that was to provide a resource for someone or anyone who didn't understand anything and really wanted to learn it. And then had a protocol to implement right away. And the amount of feedback I've gotten over the years about women saying, wow, this is exactly what I've been looking for this whole time. I feel like I get a lot of supplement recommendations and things like that, but I don't get like a clear step-by-step protocol. And I'm big on the step-by-step protocols.
Yes. Yes.
I like that because I just really want everyone to understand it and implement it to the best of their ability so that they can sort of get out of the hamster wheel of, just continuing in this cycle of seeing doctors that are not going to be able to help them because it's just not how they're trained. It's nothing against them. It's just like not part of their repertoire.
Well, yeah, like I said, you've taught me a lot, and I went through chiropractic college and naturopathic college. You'd think I would have had a more extensive education than your typical MD, but not really. I mean, it's, here's your menstrual cycle here. And I do understand bioidentical hormone replacement quite well, but again, that's in usually a later aged woman. That's usually somebody, walking out of worrying about their period so much. They're starting to lose their period. And that's where I would come in. So yeah, I've learned so much from you over the years. I love it. And then tell them where to find you. Instagram, where else? Everything.
Yes.
The website, everything.
So yeah, you can find the quiz and the membership at fixyourperiod.com. It's all there. I'm on Instagram as well. It's at Nicole M. Jardim. I share a lot of stuff on Instagram, as you well know, Tina. And, my goal really is to just educate as much as possible so that we have an understanding of what's going on with our bodies so that we can be empowered to make decisions about them that, that work for us rather than feeling like we're just lost and feeling around in the dark. So I also have a podcast. It's called The Period Party. So you can find that as well at NicoleJardim.com. So on my main website, my blog is on there and all my information.
Yes. Yeah. And it's beautiful. And it's a wealth of knowledge in there. So yeah, everybody go check it out. We'll make sure everything's in the show notes. It's been so fun having you on today. I always learn so much and I love seeing you. And I'm glad we finally made it after all these years. It was silly. I was like, why has Nicole not been on the podcast yet? So
thank you.
Thanks for coming on today.
Thank you enough. Yes, absolutely. I'm so happy we made it happen. Thank you so much. And likewise to you. I just always appreciate your incredible knowledge. And I'm just so glad you're out in the world doing all of this. And everyone hopefully is just getting so much out of your podcast, I'm sure.
Thank you. Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guild. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.